Hi, welcome to yet another video. So this is an answer to a question I got recently. One of my friends was like, okay, I know you've been a nurse for several years, but talking to many of my friends, they've told me that they're planning to leave the nursing profession. And I was just wondering, like, what is the reason behind it? Because she is planning to go into nursing. So I had to do a little bit of research, and based from my experience, these are some of the main reasons that I really figured out that why are nursing leaving, the mass exodus of nurses within the nursing profession. So a little bit background about me. I am a nurse practitioner, dual certified in acute care and psych, and I currently practice both of them, one full-time and one just part-time. And I've been a nurse for, I'll say, about 16 years now. No, has it been 16? Oh my goodness. No, 13 years. Yes, 13 years in nursing and about 16 years in healthcare as a whole. Starting out as a CNA, LVN, RN, and I'm now working as a nurse practitioner. So one thing I wanted to mention is that a lot has changed within this specific profession. Many are moving out and many are coming in. Like right now, there's graduations everywhere. People are graduating. There's all these new nurses being welcomed into the profession. At the same time, there are many people leaving. So why are nurses leaving? Looking back, nursing has changed a lot over time. And the most change I have seen is during and after the pandemic. As we all are aware, there was so much going on into this profession. People were sick from all over. There was this deadly virus that nobody knew about. However, nurses still had to leave their homes, leave their houses, leave their family, and go and attend to these sick people, not knowing what you're going to contract while you're there, not knowing what's coming after that. And many nurses lost their lives to this deadly virus. However, at the end of the day, you still have to leave and go to work because you need a source of income. You need to take care of your patients. You need to take care of your family. So one thing I know for sure is that there is a lot of burnout. That's the main thing. And if you look through my channel, I did a video earlier on in this channel about avoiding burnout. However, some of these things I feel like are beyond our control as nurses, as healthcare professionals. So burnout is a very, very key factor in this because nurses work long hours, they go home tired, they don't want to talk to anybody, and they have to do the same thing over and over again. And some people, you find that they even work more than one job. Work full-time here, work full-time there, and you don't really get time in between to rest your body. This body has to be taken care of. It's not a piece of metal. It is special. It's a temple of the Lord. You have to take good care of it, meaning you have to feed it, you have to give it a restful night, you have to take care of your skin, you have to do your meditation, you have to take care of your mental health. So if you don't do all this, before you know, you're going to be burnt out. And it's a no-brainer. Burnout is going to catch up with you one day or another if you don't take good care of yourself. The other thing that I know for sure is because there is lack of support within the management. And this is why people are leaving to go travel, because they know as a travel nurse, you're not really bound to this place. You can do your 6 to 8 weeks in one place and leave. Right now where I work, there's a lot of contract nurses who come in for like 3 months, some people 6 months, some people even stay for a year, but they know they're not bound to this place. They can terminate their contract when it's all done and leave and go. If they're not happy with this place, they leave and go. Versus going to another place, let's say a bigger hospital, where you are hired and you signed for this bonus, and you know, oh, with this bonus of 10 or 15,000, I'm bound to stay in this place for 3 years. If I leave ahead of time, I have to pay them back. So some people look at it and they feel like the 15,000 is a lot of money. But within these 2 to 3 years, when you're bound here, you realize that you're not really happy. you're not enjoying your job as a nurse. So, and some of these things are stemming out from the poor management, the lack of support you get from your fellow nurses, the lack of support you get from your management, your leadership team. So these things here will make somebody leave the nursing profession. Another thing I know for sure is the change in technology. We know about the technology system. During and after COVID, there was a lot of virtual services offered within the healthcare profession. People can work from home, people can work from wherever they are. You can travel, sit in your hotel, and just do your job. So a lot of things are changing. There's a lot of IT related nursing jobs that people are leaving to go into. So that's another big reason why people are leaving. The other thing I know for sure is that people are looking for better education, higher level of education. Nurses have left the profession to go to do their master's degrees. I know nurses who are leaving to go to medical schools. People are leaving to go to different professions. Like I mentioned, IT technology. People are moving from bedside nursing to go do IT related jobs, EHR, electronic health records. These are things that have become more prominent, I will say. A lot of systems are moving into electronic health records. So nurses are moving to go train others about it, are moving to just work from home remotely while still getting a paycheck. And above all, avoiding the burnout and dealing with the nasty systems that are out there. The other thing I want to say is that nurses are looking for more flexibility. When you're bound to a specific system, you have to work your 312s, your 410s, or your 9 to 5s. But with the current system, a lot of people are able to do fewer shifts, work as needed, PRN here, PRN there. So they're able to pick out whichever shifts they want to work. So let's say somebody has 3 PRN jobs. They can pick one shift per place every single week. And that still gives them the total number of hours they need for a week. And with this, you really avoid all the drama, all the politics that go on within a specific facility. Another thing I want to say is that a lot of nurses have gone through a lot of mental health changes. And at some point, you have to weigh the options and see, what do you need as an individual? What do you need for your family? During and after COVID, nurses went into a lot of depression, a lot of anxiety, and a lot of nurses are going through post-traumatic stress disorder. Imagine like those who worked in New York during the heat of the COVID season. Nurses, patients were dying left and right. And other nurses even took away their lives because it was too much to handle. In my previous video, I talked about taking advantage of the available resources. There are psychiatrists out there or even chaplains for specific organizations that they offer for free. So if you feel like you went through a lot of mental changes during and after COVID, please seek help. This mental health issue is real, and we are still in Mental Health Awareness Month. Always prioritize your mental health. It is very key, because if you don't take care of yourself, you really can't take care of your patients. So as it said, I take care of me so I can take care of you. Above all, always remember, you are a priority, you are an individual, and your facility will thrive with or without you. So that's a short video on why nurses are quitting the profession and why you as a nurse, you need to take good care of yourself if you decide to continue with this profession, because it's very rewarding. You know you're taking care of patients, you know you're taking care of people, and you are rewarded, you are blessed to be able to take care of people. And we know nursing is changing, healthcare is changing. People are always sick. People are always going to be giving birth. People are always going to be having accidents and injuries. And people are always going to be going to school to become nurses. Don't be discouraged. Always make sure you take good care of yourself. And that's my short video. And as always, peace out.